Let's talk about the WBA program. This WBA program is mainly for those people who have already passed their AMC MCQ exam and are now ready to start looking for jobs in Australia. Now, to get these jobs, there are some things you need. First, as I said, you must have passed your AMC MCQ. You also need to show your English language proficiency, and then very importantly, you need a job offer. This job offer must be from a hospital that actually offers a WBA program. So your first step is to find out which hospitals have this WBA program. For that, you can go to the AMC website, and there you'll find a list of these hospitals. Once you have that list, the next step is to start applying for jobs in these hospitals. Now, I must tell you, it's not going to be that easy because there are only a limited number of hospitals in Australia that offer this WBA, and they are spread out across all the different states. So you might need to try out your luck in many states and see if any one of them accept your application and offer you a job. If you're successful and get a job offer, you then go through the usual process of applying for your limited registration with the medical board, and then you can start working in that hospital. But this is not the WBA program yet. You're not in the program at this stage. You have just become an employee of the hospital, and this is actually an eligibility requirement for most hospitals before they even consider you for a WBA. Once you start working there, the hospital will from time to time ask for an expression of interest for their WBA program. Getting accepted into the program then depends on many different factors. Sometimes people have to wait for up to 2 years or even longer. This is because the WBA seats are very limited and there are many candidates hoping to get a spot. So you'll likely have to wait. If you're accepted into the WBA program, you then complete it. This usually takes about 12 months. If you successfully complete the program, and many people do, then you can get your AMC certificate. Once you have the AMC certificate, you can then apply for your general registration. So yes, if you go through the WBA pathway, you don't have to do the AMC clinical exam, and most of the time, this is the main reason people want to choose this path. But what you have to remember is that there are very limited WBA places available, and getting into the program itself is not that easy. So is it a good option? Well, of course, that depends on how you think about these things and your personal situation. But from my point of view, it's perhaps easier and quicker to do the AMC clinical exam first. Pass it and then look for jobs. That way, perhaps you'll be waiting for a shorter time to get your general registration. If you have any questions, please let me know in the comments.